I'm Dr. Robert Odell from the Neuropathy and Pain Centers of Las Vegas. Many patients who have low back, thoracic, or neck pain do not require surgery. Many patients will get better with just conservative techniques, but if that doesn't work, we then move on to interventional pain management. One aspect of spine care is the use of radiofrequency, where we target the medial branch nerves, which are right here, located right here in the lumbar region, which innervate the facets. The facets are in the back. Those are the joints that keep us from turning all the way. In the neck, they're a little flatter. That way you can turn your neck one side or the other. This is a very common cause of neck pain and low back pain. Facet-mediated pain is simply arthritis, just like in the knee, except the joint is much smaller, and the MRI is usually useless in terms of determining whether it's facet pain. Typically we do our nerve test, and if that's close to normal, we know it's not coming from the disc, so we will do a diagnostic block of these facets to see if the pain goes away. Once we've determined that the facets or the sacroiliac joint, another cause, may be the pain generators, we can then consider treating them with radiofrequency. Radiofrequency is widely used in medicine, and in this particular instance, it's used to burn the medial branch nerves, or the little nerves that go from the spinal cord, come down across here, and up to this facet and down to that facet. Radiofrequency is used for a lot of other purposes. It can be used to burn peripheral nerves. It has wide applications, but sometimes you have to be careful. But this is a well-known, well-accepted utilization of radiofrequency. Before, radiofrequency was done with a very thin needle. However, with the new technology, with cooled RF and this Trident needle from Duros Technology, a Canadian company, if you can see this, you'll notice that when I turn the needle, it's a Trident, and there's three tines come out. These burns have to be quite limited because we do not want to burn anywhere near these large nerves. And with our radiofrequency machine, we always check that. Open this up, and bingo. We check for nerve stimulation to make sure we're not too deep, not too close to the big nerve, and we get a much superior burn. These little nerves do grow back, but with the Trident and other large lesion technology, typically they last for 6 months to 2 years before it has to be redone. I have found this has really revolutionized how I treat people with medial branch pain in the low back, neck. In the thoracic region, the nerves actually float somewhere in here, and I've had and with a standard RF needle, with just a thin needle, it's very difficult to find that nerve. I've had no failures with a few thoracic facet cases I've done. It's one of the most rewarding procedures with the doctor and the patient because it works so well.